Carol Cochran Phillips, Persuasive Speech. ACL tears and rotator cuff tears are two of the most popular sports injuries that happen today. Many injuries require surgery. However, with our advancements in medicine, many injuries can be repaired by physical therapy. Before I began studying my major at Anderson University, I had this idea that physical therapy was only used for patients to be treated after they had surgery. I think a lot of people have that same idea. Personally, I have always been a believer that surgery should be the last resort. About 10 years ago, my aunt had a double knee replacement done for her arthritis in her knees. But the surgery was unsuccessful and her knees are in worse condition than they were before the surgery. I am now convinced that if she had just gone to physical therapy before the surgery to strengthen her knees, she would be in a better position. However, everyone's bodies are completely different. Surgery might be an option for some depending on how long they've had the injury or how the injury is progressing. Physical therapy might work well for someone and can avoid surgery altogether. It all depends on how each person responds to the treatment. I've been working at a physical therapy clinic in Clemson for several months, and I did an internship at a physical therapy clinic during my last semester at Anderson University. Most of the patients that come to therapy are elderly individuals with some type of pain from arthritis, although we do have some patients with traumatic injuries and were forced to have surgery. Since meniscus tears are the most common types of sports injury in the lower leg, many studies have been conducted on the use of physical therapy for meniscus injury instead of surgery. In the Meteor Meniscal Tear and Osteoarthritis Research trial in Chicago, 351 patients from 7 clinics across America were studied. All of the patients were 45 and older, and all showed at least one sign of meniscal damage, such as a clicking or popping sound when they would walk. During the study, 174 of the patients had surgery, followed by physical therapy, and 177 of the patients only had physical therapy alone. Both of the physical therapy regimens were broken into a 3-stage program, which allowed the patients to advance to the next intensity at their own pace. The program was designed to allow for 1 to 2 sessions per week for about 6 weeks, and that included at-home exercises. Experts evaluated the patients at 6 months and 12 months after the physical therapy ended. At the end of the 12-month study, both groups had very similar results. One of the most serious injuries, particularly in baseball players, are rotator cuff tears. Rotator cuff tears are generally repaired by an extensive surgery followed by several weeks of physical therapy. However, a study in Finland discovered that for non-traumatic rotator cuff injuries, physical therapy alone was just as effective. 167 shoulder patients were divided into 3 groups. The first group only received physical therapy. The second group had an acromioplasty done by an arthroscope and physical therapy. And the last group had a complete rotator cuff repair along with physical therapy. All of the patients in the group were roughly the same age, and the sexes were divided up evenly. The components of physical therapy remained the same across the groups. The groups were educated on light at-home exercises for the first 6 weeks, then increases during the next 6 weeks, followed by an increase in strength and resistance training for up to 6 months. When each of the groups were done testing, after 3, 6, and 12 months, the groups were very similar. The authors admitted that after all the testing after 1 year, the surgical repair constant score was not any higher or better compared to the group who only had physical therapy. A couple of years ago, my uncle told me about one of his friends who created his own physical therapy program to treat a torn Achilles instead of having surgery. My uncle's friend had not met his deductible on his insurance, and therefore it would not cover the surgery. So for 6 months or so, this guy researched on the internet different exercises to do daily, multiple times a day, to heal his Achilles. After many months, he successfully healed his Achilles without any surgical procedure. Not only is physical therapy a good option for humans, but it also works for dogs. While researching online, I found a blog where a lady successfully healed her dog's torn ACL without her having to have surgery. She documented the whole process on her website. Birdie, the dog, tore her ACL, but her family could not afford the surgery they were told that was needed. The first step to help Birdie was her family restricted her physical activities. so there was no jumping, running, or jumping off the couch. The second step was her mom restricted her diet. Birdie is not overweight, but any extra weight could be hard on her joints, so they wanted to make sure she did not gain any extra weight during her injury. Birdie began attending physical therapy 5 times a week with the treatments that included cold laser treatments, manual treatments and exercises, and hydrotherapy in a heated saltwater pool. Eventually, after 3 months, Birdie only went to therapy twice a week, then eventually once a week, and finally every other week. The therapist that helped Birdie along with her healing process told her family that from the beginning, conservative management, aka not having surgery right away, was the best option. Eventually, Birdie had made so much progress, she only started to come to therapy once a month. Birdie had full extension in her leg, is full weight bearing, and can run around. And she has no sign of pain when her leg is being manipulated. Birdie seems like she has made almost a complete recovery with some time and hard work. I've always had an interest in animal physical therapy. If I do decide to pursue physical therapy as my career, the University of Tennessee has a certificate program for animal physical therapy, which I think would be so rewarding. In an article I found from Pacific Orthopedics, they stated how physical therapy is becoming more popular. Many doctors are using it as a first treatment to see if the injury will heal instead of having surgery. Going through physical therapy first, if it's successful, allows the patients to get back on their feet more quickly and heal faster. Since I've discussed some of the major injuries that can happen, I decided to print off some diagrams. This is a diagram of the knee. So we have the femur and the tibia right here, and the patella, aka the kneecap. And this is the LCL and the MCL. And this one right here, this thick band right here in the middle, is the ACL, which is what you hear tear the most often, especially in sports and basketball. You hear of that injury happening. And then this is the rotator cuff. This is the back view and this is the front view. And it's made up by 4 different muscles: the infraspinatus muscle, the teres minor muscle, the suprascapularis, and the supraspinatus muscle. And that's one of the most common injuries that I had discussed earlier. And this is a picture of the back of the ankle and heel. And I talked about how my uncle's friend made his own physical therapy program for his Achilles. And so this is the Achilles right here. It's this thick band that runs down the back of our leg that connects the 2 sides of our feet together. Thank you.